Hi. On 31st of May 1988, WHO called for a war against one of the most deadliest killers of mankind, which is tobacco. Since then, on every 31st of May, we celebrate this war, calling it the World No Tobacco Day. Tobacco use in all its forms poses a very high risk to your well being. The statistics are indeed very startling. According to the WHO, every year the tobacco use directly kills about 70 lakh people, and indirectly another 10 lakh, 10 to 12 lakh you can add to it. So you can estimate how dire the situation is with tobacco. Tobacco consumption, it can be in any form. It can be in a smokeless form or the smoke form. Smokeless form is the chewable tobacco, which is khaini, gutka, pan masala, and smoked form is cigarettes and BD and the other uh, non-modern types like hookah. So tobacco consumption causes about so tobacco consumption causes about 30% of all cancer deaths. So that itself is a very high number. The use of smoking and smokeless tobacco is highly prevalent among all age groups in India, with children as young as 10 years falling prey to tobacco habit, according to the Indian Journal of Pediatrics. The youngest case which I have seen of cancer due to tobacco use was of an oral cancer patient. The child had contracted the cancer when he was 12 years old. He was diagnosed of cancer when he was 12 years old. He had started chewing tobacco when he was about 7 years of age. It was by influence of his father, who used to chew tobacco since his young age, and then following him, the father, fortunately for him, had no cancer, so probably that had provoked the child also to start at a younger age. About 70.5% of youth in India in the age group of 13 to 15 use tobacco in some form, and every fifth adult is a smokeless tobacco user. The GATT survey of 2016-17, unfortunately, that is the most recent survey in India related to tobacco which we have, showed that a whooping 28.6% of Indian population has the habit of using tobacco. India accounts for about 74% of smokeless tobacco related deaths, according to a study in the US. These numbers depict a worrying scenario as they go to show how widespread the tobacco addiction in India is. The cost of tobacco related illnesses to our country is about 27,700 crores. Some few more startling statistics. About 450 children start smoking every day. 3 persons die every 2 minutes due to smoking. 250,000 tobacco related cancers are diagnosed. Daily, about 2,200 of them die of this cancer. Every cigarette takes away about 11 minutes of your life. It also reduces your fertility rates, and in children, it will cause poorer performance in their schools. 40% of the detected cancers in India are oral cancers. Out of this unbelievably high number, about 80 to 90% are due to tobacco. Most of these cases, unfortunately, seek treatment at a very late stage. That is when they are about stage 3 or stage 4. That is the time they come for treatment. So now these are the statistics basically which highlight something which we already know, which most of the people know, that tobacco is a killer and how serious the situation is. Everybody knows about it. In the theaters, we see those ads and the infomercials where they show the tobacco related growths on the face, the surgery, the post surgery effects and everything. Still, somehow in our Indian population, the effort which the doctors and all the experts are making to spread the awareness just falls on deaf ears. It fails to penetrate the thick skulls of our minds, and so it is still rampant. Still, the market, the Indian market, which is about, I think, the first or second largest market for tobacco consumption, and it is not reducing. So you can imagine, just by curtailing one habit of chewing tobacco or stopping the smoking, you can cut about 30% of cancer and cancer related deaths in our country. And you can save, our country can save about 27,000 crore rupees of money, which is spent on the treatment of these patients. Now, the economic aspect of, for one person, just one small example, the average cost of one cigarette must be 15 rupees or so today. If you assume a smoker smokes 10 cigarettes a day, that is 1,500, 150 rupees per day, roughly about 4,000 rupees or so per month. And that is about 30 lakh rupees over a period of 30 years. And if you take interest and everything, if that person would save that money, he would accumulate about 1 crore rupees in the same period of time. So instead of smoking, if that person starts saving that money, he would save a crore or rupees in that period. So you're wasting your personal money. Plus, that doesn't account to the illnesses which you are going to contract because of this smoking or chewing tobacco, which the treatment of which nowadays is very expensive. If you go to government hospitals, the treatment is not so easy to get. Plus, if you're going to go to a private hospital, you're going to be spending lakhs of rupees, 5 lakh rupees, 10 lakh rupees, 30, 40 lakh rupees. You don't know how much you're going to need for the treatment. The treatment is so complex. You require surgeries, you require chemotherapy, you require radiation. The surgeries are have certain effects later on your lifestyle. It is not always 100% the same as it was earlier, depending on the stage of cancer you were at which you were diagnosed. So overall, it is a very pitiful situation to put yourself into when you continue chewing your tobacco or continue smoking your cigarettes. So, knowing all this, if you're already a smoker or if you're already chewing tobacco, there are certain points of caution which I would like to tell you all. So, caution, as the word goes, change in your bowel habit. If there is a sore or an ulcer in your oral cavity which is not healing, if there is any unusual bleeding from your nose or your throat or in your cough, or there's vomiting with some blood stains in it, any thickening or any lump noticed in your neck or in your cheek, if there is any difficulty in swallowing, any pain during swallowing which does not get better with medicines, which stays or goes on increasing, any wart or mole which changes its appearance over time, and any cough or change in voice or hoarseness of voice, which is again doesn't get better with the medicines. A white patch or a red patch or a mixed white plus red patch, which is again it doesn't get better with medicines. You should consult your doctor for that. If there is any black pigmentation over your cheek from your inside, if there is any growth which is observed, if you have difficulty in opening your mouth, if the mouth is slowly over a period of time, if your mouth opening reduces, then those are all indicators that there is something suspicious underlying, and which could indicate undergoing a cancer. Any unexplained weight loss is another thing which can be attributed to cancers. So all these are just things which, if you are already smoking or already chewing, you should look for, and you should try and start thinking about quitting your habit as soon as possible. If you manage to quit, these are the benefits which you will achieve. when a smoker quits, within 20 minutes of quitting, a user's heart rate and blood pressure drop to normal. When within 12 hours, the carbon dioxide levels in the blood also fall within the normal range. Function shows improvement from 2 to 12 weeks. Throat irritation, cough reduced in 6 months. Within 5 to 10 years, a user's risk of stroke and heart disease falls by 50%. In 15 years, a smoker's risk of cardiovascular ailments are the same as those of a non-smoker. So it takes about 15 years for the risk to reduce completely for all kinds of diseases related to smoking. So even if you are consuming tobacco, do not still, as in, obviously you have to quit, but if there are any warning signs which you observe, do not fear to consult your doctors. It is very important to consult your doctors as soon as possible, as the earlier the diagnosis, the better the treatment and the better chances of a cure. For statistics, if you would like to know about, for a stage 1 or an early cancer, about 95% cure rate can be achieved. For stage 2, an intermediate rate, about 80%. Stage 3, about little lesser, 60%. And higher stages 4, stage 4, it would be even lesser, maybe 30% or so. So meaning what this tells us is that the earlier you come, so stage 1, stage 2, if you suspect something, just immediately come to a doctor. If it's not a cancer, it is good for you. But if it is, then it will be diagnosed earlier and you'll be treated better, and the outcomes of the treatment will be much better. So will your quality of life also will be much better. So basically, in terms of cancer, if we are speaking about cancer, tobacco forms about a major burden of cancer, as in the main carcinogen, you can say. As we had discussed earlier, about 80% of oral cancers are due to tobacco chewing or smoking. So just curtailing one habit of yours, which is definitely harmful to you, you overall you will reduce this cancer risk for yourself. You will be doing a good for your country as well by just quitting this habit. So a take home message: don't consume tobacco in any forms. No, neither, as in either smokeless or the smoke forms. Do not consume tobacco. Eat a healthy diet, lots of vegetables, fruits, high fiber foods, rich in vitamin A, C, E. Eat a diet with fewer animal products. Avoid red meat and exercise regularly. All these things will help you after quitting to get back to a low risk person. Thank you.